Hello everyone, this is Medical Gateway, and in this part we're going to study regarding the leukopenia. So what exactly is leukopenia? So in leukopenia there is decreased production of white blood cells. So decreased production of white blood cells is known as leukopenia. So why there is decreased production of white blood cells? The reason is because of the damage of the bone marrow. The bone marrow has to produce the white blood cells. And now, if bone marrow is damaged due to any reason, then the white blood cells will not be produced in the required quantity. Now, which are the things which can damage the bone marrow? So it's, in order to remember it, there are only two types of things which can damage bone marrow. One is the radiations and the other ones are the drugs. So radiations include the X-rays, the gamma rays, whereas the drugs include the benzene, anthracene nuclei, chloramphenicol, thiuracil, and the barbiturates. They all can damage the bone marrow, resulting into decreased production of white blood cells. Now, what is the function of white blood cells? White blood cell basically protect body against the foreign infections. Okay, now there are no white blood cell, or the white blood cell number is decreased. What will happen? There will be decreased immunity. And when there will be decreased immunity, the body will be prone to a lot of infections. Okay? So, any infection which the body can previously easily fight, the sore throat, the body can easily fight a sore throat. But here in this case, the immunity is decreased to the extent that any infection can turn into a fatal infection. Okay, but the most serious state is, that there are, in the normal flora of body, there are microorganisms already living in symbiotic relationship with the body. For example, in the gut flora, we have a lot of microorganisms. Those microorganisms get energy from the body, and in turn, they help the digestive system digest a lot of substances and maintaining the gut health. So the normal flora is always there, working in a symbiotic relationship with the body. But when the immunity is decreased to a very low extent, it results into the normal bacterial flora being activated, being multiplied and activated to such an extent that it starts causing opportunistic infections. Now, this is the worst case, that the normal bacterial flora, no microorganisms from outside is causing destruction, but the bacterial flora inside our body has turned against us. The normal bacterial flora has started causing the opportunistic infections. And that just takes place in 2 days. It is pretty quick. Whenever the immunity falls below a certain level, the bacterial flora just attacks the body. Okay, and this condition is extremely lethal. And this can result into death in less than a week if not properly treated by a lot of antibiotics and a lot of immunoboosters. Okay, but what is the main treatment if there is decreased production of white blood cells from bone marrow? The main treatment is only one: bone marrow transplant. First, stop the triggering factor, the thing which is damaging the bone marrow. Okay, stop it. And then go for the bone marrow transplant. Okay, this is the only treatment. So this is leukopenia, decrease in white blood cells, decreasing the immunity to a very fatal level, treated by bone marrow transplant. See you in